know we are here. I'm recording if that's okay. So, yeah, so today's session will basically comprise of your understanding, developing an understanding of you regarding these inequalities in health and social determinants. So, the indicative content today will be, like if we talk about, as I said, factors within health and factors within social, the social paradigm. So there's some health determinants and then there are some social determinants. What are those? So health determinants include age. Age is a factor. Sex, your male, female, and in between, whatever. And hereditary factors. Lifestyle, it's a health determinant. So health is determined by your age. The younger you are, the weaker you are. As you grow older, you become healthier if you're not suffering from any hereditary factor, hereditary condition. So all of these are, there's called a web of causation. So everything is interconnected. So your age, so it depends, factors of your age, they depend upon, there's certain hereditary factors that determine your health as well, and that those have an impact on your age. There's lifestyle that could also be a determinant of health. Social and community networks, so if you have strong community networks, just a minute. Yeah, sorry. So there are cultural and environmental factors and conditions, nature and nurture. So any idea what cultural and environmental factors comprise of? Any idea? How do they determine health? Anyone?
Okay, so I think when we say culture, it is just um the behavior of people depending on where they are coming from. So if you are trying to use culture and environmental factors, like someone from Africa, is different from someone who lives in England here.
Yes, exactly. So your culture determines your health as well. There's certain cultural, for instance, there are certain cultures who prohibit breastfeeding. There's certain cultures for some time. There's some cultures that prohibit colostrum. So the first milk that comes for the baby from the mother's breast. So that is really research has shown for years and years that it's one of the first best antibiotics for the child that protects the child against infections for the rest of their lives. However, in certain cultures, this is prohibited and you cannot go beyond what is prohibited for you. So, and this is why there's certain children who are malnourished.
Please, we can't hear you.
Yeah, sorry, there's some connectivity issues. So there's cultural factors that determine health, and as well as environmental factors. We have certain adverse environmental factors that would lead to adverse health outcomes that we all know. So health and well-being, inequality. So health, we know that health is not equal across the globe. Even in the same country, even in the same region, there are certain inequalities that exist between health and well-being for different social groups. So these may be social class, race, your ethnicity, your gender, your geographical region where you live in, such as rural or urban areas, disabilities, they lead to inequalities, your age, your vulnerable groups, or your inclusion health groups, such as vulnerable migrants, different people, and as you can see, it's evident from this slide that several people who may be impacted by these inequalities in health and well-being. So how do we determine health? What are health determinants? So these are various factors that influence an individual's health status. So if you're healthy, and there's a hereditary factor, as I said earlier, or there's an environmental factor. We are hearing a lot about monkeypox now. So if you're healthy, you're fit and fine, but something happens in the environment, or there's a change in your immunity, for instance, that's within you. But if something happens outside you, that could impact your health. So health is determined by various factors. So they can contribute to the onset of illness or disease. So some people, they may develop cardiac diseases because they have they're in a society that leads them to smoking. There's peer pressure because of which they smoke. But if that person has no hereditary factor, that person is safe to some extent. But if there's a hereditary factor, that increases their chances of having the cardiac issues. So these factors can be biological, as I said. They could be hereditary, environmental. So your environment is adverse, it's not suitable for you, or it's very good and you go have a good health. Social or economic, so bad economics, stresses, mental health issues, physical issues they turn into, and they can vary in their level of influence on an individual's health. So some common health determinants could include genetics. So this is obviously the genetic makeup within you. It plays a crucial role in your susceptibility to certain health conditions. So if my ancestors or my older people, they did not have diabetes, I'm less prone to develop diabetes. However, I have my environmental factors, my lifestyle factors, my social factors, my healthcare access and quality also, that could then be a factor in determining certain health conditions of mine. So if I'm not having a good diet, no matter if I don't have the genetics, I still might develop diabetes. So in your environmental factors, that's air, you have moldy houses, it leads to various cardiac issues, various respiratory issues, certain toxins that come with food, certain pollutants that can give you certain cancers, certain mental health conditions. Lifestyle factors include diet, your exercise, your smoking. So a positive lifestyle, obviously a positive environment, will always support you in your in better health. Now and then there's social factors. Social determinants would include your income. You have a good income, you're relaxed, your children are relaxed, you don't live stressful lives, you don't have mental health issues, you don't have issues For education, your employment is okay, social support is there, access to healthcare. These can all impact your health outcomes. And then healthcare access and equality. So access to quality healthcare services and the ability to receive timely and appropriate medical care can also influence an individual's healthcare. So I have a question here. There's a term we call modifiable risk factors. So there's certain risk factors. You can call these factors risk factors also. So they're a risk to certain ill health conditions. So there's certain modifiable risk factors. So you can modify them with time, such as if you smoke, you might stop smoking. So that can be changed. But there are certain things that can't be changed. Can you comment on what things would you call in this list as modifiable and those that you could call? So let's just talk about the non-modifiable risk factors. Which would you say that cannot be modified, cannot be changed, and why?
Okay, so I think that genetics cannot be modified.
Very good. Yeah.
Yeah.
Yeah. So
Yeah.
you can't modify your genetic makeup. So if your ancestors had some disease, you cannot. Environmental factors, probably you're living in some place and you plan to decide, decide to leave that country. So that's modified. Your lifestyle is to a very great extent, it's modifiable for those who would want to modify them. So you need the will to modify that. Social factors, again, it can be changed. It's not something that can never be changed. You might not have social support in a certain country, but then when you leave that country, you go to a more accessible country where you have more social support. You go to that country because of more social support. That is modifiable. So it's something that's hard to achieve if you don't have a good income or good education, etc., or good employment, but it's not impossible. So genetics is impossible to change. Okay. Healthcare access also in the same way. Probably you got a better job and your healthcare access became better. You could afford to see a private GP also. So that could be modified as well. So there are certain health determinants. So we talk about age, such as chronological age, so sort of from your birth to your old age. There are certain factors that lead to physiological changes related to age. So aging, sorry. So as you age, you deteriorate, obviously. And then your sex, so biological sex, so certain people who have they're males who are more prone to develop heart diseases compared to females. That has been found out through research. And then there's gender identity also. So these factors also determine your access to health, it's a determinant of health. Hereditary makeup, family history of illness or disease. We've talked about this. Lifestyle includes diet, nutrition. This is just a table. They've given just a table just to reinforce what has been taught already. So socioeconomic includes income and wealth, educational level, occupation and economic employment status. So please remember that all of these are interconnected. So if your air and water quality in your environmental factors and conditions, they're not good, you might change and you go and have a better job. So your income has an impact on your environmental factors. Sometimes you would say cultural factors are not modifiable. So it's beliefs and values. Sometimes they're not going to be modified for years and years unless you make a deliberate effort. Nature and nurture. So genetic factors are there, which is in your nature. And then there are certain environmental and social factors that nurture or impact or change your disease status. They could have an impact. So nurturing is another concept that we'll talk about again as we move on. I'm a researcher, so I have great interest in research and especially in public health research. So there's a project that I did. I'm just sharing this with you to give you a better understanding. I did it on pregnant women because when I was pregnant with my child, it's been 5 years now. I was stopped from being physically active. So the culture that I live in, they recommend not to be physically active, especially during the first trimester. But because I was a teacher, I was an assistant professor at a medical college. I could not afford to miss my classes. So I made an effort and I was very physically active. So I had to walk, I had to stand for 1 hour. It was a 1 hour long lecture. And that made me think about what are the other cultures doing. So I had a brilliant pregnancy. My child is as physically active as I was during my pregnancy. Touch wood. So this led me to do this research on the women who were coming to that hospital. So it was a hospital also. It was a medical college and a hospital. So I did this research and I saw that those women who were pregnant, what are the barriers and the facility share that again. So the point that I wanted to make is that your factors, so these are interconnected. So you have your cultural factors there, but then there's you might not want to be physically active because and then there's the major barrier that was found in that research was fear that something might happen to the child. No, that's not possible. Why would anything happen to the child? Why do we blame being physically active for anything, any adverse outcome? You're not supposed to exert yourself too much, but to a certain extent, you can be physically active. So socio-economic factors can impact lifestyle choices and access to healthcare, which can in turn affect overall health outcomes. So when you understand this complex interplay between factors, it's critical to promoting health and well-being at both the individual and the community level. Is that clear? Any questions? So this shows that there's several factors that are responsible for determining health and your social well-being. It's not just, so if it's age, certain people, they would not let an older person, if they see an older person being very physically active, they would be cautious. But if they're doing it within a certain limit and a certain safe limit, it's okay. So there's a as I said, it's a web of causation. Everything is joined like a web and you can't separate them. So then there's certain factors such as, yeah?
Okay, so I wanted to find out, can religion also be a factor?
Yes, definitely. Definitely. So your religion, it's very much, it impacts your lifestyle. Okay. So there's certain people who are purely vegetarian. There's certain people who won't. That's religion. Okay. So you're missing on those diets. Now we can't impose those diets on them. They can have some alternatives, but it's not possible for them to obviously change their lifestyle. So there's religion. That is one thing. Obviously, it's modifiable for some people again, and it's not modifiable for certain other people. So in your religion, there are certain people who are vegetarian, purely vegetarian, but then within that religion again, there are certain people who are not vegetarian. They eat mixed diets. There are certain people in your religion There's certain cultural factors. So your beliefs and values within one religion, there's several beliefs and values. You can agree with me. So within my religion, for instance, if I say for Islam, you have Christianity, you have Hinduism, you have Judaism, there's several religions, you have different cultural factors. Now, if every religion in its core is for positivity, it leads you towards a better life, it leads you towards a positive life. Religion will never stop you from being physically active. No religion that I know. It's our cultural beliefs also that we then say that, no, this is because of religion. No, there's certain cultural factors. This is because we don't have proper understanding. So there's certain religions that within religions, you won't say that it's religion. It's culture that keeps people closed. Like, for instance, it's women who are supposed to be they need to remain indoors. That's a culture. You need to separate that from religion. Again, as I said, lifestyle, your religion can have an impact on all of these. So there's no religion that would allow, that would say yes to these, because this is harmful. So religion is always going to be helpful for you to bring positivity instead of negativity, which this does. Is that clear?
Yes, please. Thank you.
Yeah, nice question. And then we have your social group. So your social class, obviously, you know, the lower social class that you exist in at the moment, you have, it would determine your, for instance, access to health, your access to education, your poverty, whether you are living in a lower socioeconomic status, your exposure to environmental toxins. So, and then if you start earning better, these people then, if they lack these amenities of life, they have then a lower quality of life. They have lower life expectancies as well. They have higher rates of illness and disease and poorer health outcomes. So your social class, there's health inequalities within the social classes and what contributes to them, it's shown here. And then your race or ethnicity. So higher rates of illness and disease are in certain races. Their poor health outcomes, lower life expectancy compared to white populations, for instance. And the reasons for this may be discrimination, there may be racism, lower quality of healthcare, and lack of access to healthcare services also. Then you have your gender. This is all social issues. Men have higher rates of mortality while women experience more illness and disability. So what are the reasons? They're difference in biological factors. That's our biological makeup. Gender can be changed, but sex cannot be changed, obviously. Your societal norms and expectations and access to healthcare. They're all, research has shown that gender has an impact on them. Then your geographical area, if you're living in a rural population, obviously you have limited resources to healthcare, lower quality of education, higher levels of poverty. Your disability, so there are higher rates of illness and disease in people who are disabled, poorer health outcomes, lower life expectancy compared to non-disabled population. This is because of lack of access to healthcare, discrimination and stigma, and physical and social barriers to healthcare services. Then you have your age. Older adults, they experience high rates of illness and disability compared to younger population. This is because of biological factors, changes in lifestyle habits, and access to healthcare. And then last but not the least, it's vulnerable groups. So this happens again because of lack of access to healthcare, exposure to adverse environmental toxins and hazards. They're living in very social and economic marginalized areas. They have limited access to healthcare compared to the general population. So it's important to note that all of these factors, they're interrelated, as I'm always stressing, and that individuals may experience multiple forms of social disadvantage or marginalization. So these contribute to health and well-being inequalities. So if you want to address these inequalities, it is very important to understand what are the underlying factors which we've just discussed. There are many, many more. These are just some that we've talked about. There's political structures, there's again religion that we've not spoken about. And their policies also. And if these policies are made in a way to fit in the needs of different social groups, it is only then when we can think of lessening these inequalities. These will never be removed, but we can reduce them as much as, like all our efforts could be there to just lessen them to some extent. So if we address these root causes, so you might see a person who is unemployed, but deep down inside, what do you see? Why is he unemployed? Does he have a lower socioeconomic status? Does he have a vulnerability? Is he disabled if there's a disability, that person is marginalized. Obviously, he would not reach to the top tier, but that is unfair. If there's a person who's got a mental health condition, obviously, they're hampered in doing a certain task, but then you fit them into a certain in another task that they would excel in. But that requires a lot of effort, which we're not probably ready to do on our own. So it's possible to promote better health outcomes for all individuals, regardless of their social background or circumstances. So what is social class? It's a complex concept that can have a significant impact on health and well-being. So individuals who belong to the lower socioeconomic or social class, they tend to have lower life expectancies. We've talked about this, higher rates of illness and disease, and poorer health outcomes compared to those from higher social classes. There's several factors like lack of access to healthcare. We talked about this. So you might not have specialist care. You can't afford private care. Obviously, private care is expensive, but then even if you can, there's certain areas where even private care is not that good. So this can result when you don't have private care, for instance, or if you don't have access to healthcare, it would lead to inadequate treatment of your illness or disease. Lower quality of education. So if you live in a social class that's marginalized, you will have lower levels of education. You have not very good employment opportunity and income potential. This would contribute to higher levels of poverty and lack of access to healthcare and other resources. Higher levels of poverty, again, this is all interconnected. You'll have poorer health outcomes because you don't have nutrition, you don't have safe housing, you don't have healthcare services. Exposure to environmental toxins like environmental pollutants, they all lead to illnesses and disease, and discrimination and marginalization, again, because of certain issues such as health and social and economic statuses could discriminate you and be responsible for inequalities. Race, ethnicity, we've talked about this. So individuals from minority racial groups, we know, and ethnic groups, they may experience high rates of illnesses and disease. They might not be living in proper living conditions. They have lower life expectancies because of this compared to their white populations. So these factors may include discrimination and racism, lower quality of healthcare, lack of access to healthcare services. So when we address health and well-being inequalities related to race, ethnicity, this requires efforts to address discrimination and promote equal access to high-quality healthcare services for all individuals, regardless of their race or ethnicity. Gender, women and women, they may experience different health outcomes. And this is because of their different biological factors. So a woman, obviously, she will not do strenuous work. Even if she wants to do, there's a limit that she can do. Men have high rates of mortality again, while women experience more illnesses and disabilities because they are fragile. That's how they are. As much as you want to think they're stronger, but that's how they've been created. Addressing health and well-being inequalities related to gender requires efforts to promote gender equality. So women should have an equal chance. Men should have an equal chance in any jobs that mostly. So there was this the stories that we share, it's been a long time, but there's certain professions that when you think of them, you can only think of a particular gender. So if I talk about, let's say a cook, now obviously the norms have changed, but in earlier days, when you thought of a cook, a person who's a cook, you would always think of a woman, but now it's obviously men and women both. And then again, if you think of a pilot or a sailor, you'll have a man coming into your mind again. So that's gender roles that we've placed people into, which should not be the case. So if there's a woman who's excelling, or if there's a man excelling, obviously you would want to promote them, whoever deserves it, obviously. Then there are certain geographical areas. So if you're living in a rural area, just a minute. Sorry for that. Yeah. So geographical areas, including rural and urban areas. So if you're living in a rural area, you may experience higher levels of mortality, poorer health outcomes because you don't have access to health over there. Just let me see. Okay, we're okay with time. So as I said, that there's several factors that are intertwined, they're interconnected. And if we know the root causes, we then know how to ameliorate or reduce the inequalities. So if you address health and well-being inequalities related to geographical region, this requires efforts to promote equal access to healthcare services and other resources for individuals living in rural areas, as well as efforts to address underlying issues which are related to poverty and educational attainment. So if you're living in a rural area, obviously you have lesser chances of being better educated. Disability, age, vulnerable groups, we've talked about this. Again, we're talking, so individuals who are disabled, they may experience higher rates of illnesses and disease. They have poorer health outcomes because of this. They live for lesser years compared to non-disabled or healthier population. So there are certain factors like lack of access to healthcare. So all of these, there's discrimination and stigma, because of which they may have higher rates of illnesses. There's physical and social barriers to healthcare services, because of which they may experience higher rates of illnesses and disease. So all of these, as I said, they're interconnected. So if you're addressing health and well-being inequalities related to disability, it requires efforts to promote equal access to healthcare services, as well as efforts to address underlying issues that are related to discrimination and stigma. Again, age, so the older you are, you have more disabilities, you have more illnesses compared to younger population. What are the factors? They may include biological factors, changes in lifestyle habits, access to healthcare. So if you address health and well-being inequalities related to age, this requires efforts to promote healthy aging, as well as efforts to address underlying issues related to access to healthcare services and social support. Then there are vulnerable groups in the society. So you have certain vulnerable groups such as homeless groups, homeless individuals, you have sex workers, you have people who are migrants. They may experience high rates of illness and disease. They have poorer health outcomes and limited access to healthcare services. Again, what are the factors? These are all ingrained. So there's lack of access to healthcare, because of which they may be they may experience higher rates of illness and disease. There may be exposure to environmental toxins and hazards, again, which is interconnected. Social and economic marginalization, they have poorer health outcomes because of this also. Again, if we address these issues, it's going to be a better outcome. Inclusion health is a term that is used to describe health and well-being of socially excluded populations like homeless individuals. So you're including them. You're keeping health as an inclusive thing. You're including them in all the approaches that you take. And you consider the unique needs and circumstances of these populations. You would want policies and interventions to promote equal access to healthcare services, as well as efforts to address underlying issues related to poverty, discrimination, and social marginalization. So overall, addressing these health and well-being inequalities requires a comprehensive and integrated approach. And you would want to consider the unique needs and circumstances of different social groups. So when you address these root causes, that is when you address inequalities and try and reduce them. We're again talking about migrant populations such as gypsies, Roma and traveler communities, rough sleepers, homeless, and sex workers. So what are the factors? They then experience higher rates of illness and disease, poorer health outcomes, limited access to healthcare services. We're not even talking about education. We've not even gone to education. This is just the basic, the tip of the iceberg that we are seeing. Our education is way beyond. That's something that's so important. That's something that is so core, but that is that is way behind. We're just talking about just health and disease right now, just improving their health, just a minor thing like this. It's a major thing, but it shouldn't be a lesser priority when it comes to education. So just a minute. So Gypsy and Roma, for instance, traveler communities, they are often marginalized and may experience higher rates of illness and disease, poorer health outcomes, and limited access. Again, the factors are mostly the same. Their cultural barriers, their discrimination and stigma, lack of access to healthcare services. So when you address these issues, you're then reducing discrimination, cultural barriers, and social marginalization. You're addressing these underlying issues. Rough sleepers and homeless people, so they may experience high rates of illness and disease, poorer health outcomes, again, limited access to healthcare services compared to the general population. What are the factors? They may include lack of access to healthcare services, exposure to environmental toxins and hazards, social and economic marginalization. So when you address health and well-being inequalities related to rough sleepers and homeless individuals, it requires a multifaceted approach. You would consider the unique needs and circumstances of these populations. This may involve again, policies and interventions, and then this is how you address these issues. Sex workers, again, it's stigma, it's discrimination, because of which they lead to it's higher rates of illness. You have higher rates of disease, poorer health outcomes, limited access to healthcare services compared to the general population. When you talk about these are the core factors that would then, if you work on these, it's then going to be involving policies and interventions to promote equal access to healthcare. Even if they're sex workers, it doesn't matter. They're humans. It's our duty to serve them. It's our duty to make life better for them. Their quality of life also matters. So then we want to discuss influences on health determinants. So what are the different influences? We talked about social factors. We mentioned these before, access to healthcare services, social support, quality of education. Social factors also include cultural and religious beliefs. There you go, Matilda. Was it Matilda who asked the question?
Yes, please.
Yeah, okay. Yeah. So yeah, your religion comes there also. These may influence individuals' attitudes towards health and healthcare. There are certain economic factors like income and employment, which can also have a significant impact on health determinants. So if you have a low income, you'll have financial barriers to accessing healthcare services or nutritious food, financial stresses because of unemployment, negative health outcomes, and mental health conditions, obviously. It's depression, it's anxiety, it's frustration, obviously. Then you have your environmental factors like air quality, which is poor, access to clean water is not there, exposure to pollutants is there. These are all health determinants. Living in a polluted environment or without access to clean water can increase your risk of respiratory diseases, skin conditions, and other health problems. Then you have your behavioral factors, your lifestyle choices, which are again very much modifiable. So if you engage in unhealthy behaviors, this can increase your risk of chronic diseases like heart diseases, diabetes, and cancer. Genetics, there's certain genetic factors that include your susceptibility to disease. So if there's breast cancer, for instance, it's very common that it runs in families. It's any cancer that runs in families has a potential of reaching out to the coming generations. So there's certain wider determinants of health. These were just the main determinants of health. We talked about age, sex, and constitutional factors. We have individual lifestyle factors, which we've talked about. Social and community networks, they also have. So this is showing that how all of these impact your health and well-being. So all of these are interconnected. So living and working conditions, they would have an impact on your employment status, your water and sanitation, your health care services, your housing. These all comprise of living and working conditions. Your work environment, your education, your agriculture and food production. All of these have an impact on the individual themselves. These are general social, economic, cultural, and environmental conditions. So the wider determinants of health are a diverse range of social, economic, and environmental factors which influence people's mental and physical health. Systematic variations in these factors constitutes social inequality, which is an important driver of health and well-being. So it is very important to understand, again, when you understand the complex interplay of these influences, it is possible to develop policies. So you can't even develop policies unless you understand what are the factors that are involved in all these conditions of ill health and lack of well-being. One objective for you is to explain how inequalities of opportunity can impact your health and well-being of an individual. So we've talked a lot about these. So inequalities of opportunity, they can have a significant impact on the health and well-being of any individual. So if there's a person, even a white person, if that person is living in an adverse socio-economic status, that person would be impacted. So being white is his genetics. He was saved because of that, he or she. But then there's environment that probably had a reason there. There was unemployment, there was water and sanitation. Probably that person is living in a rural area where there's not proper access to healthcare. So even if you're white, your race would obviously determine if you're in a better condition. But then in certain conditions, certain instances, you still, I wouldn't say you're marginalized because of your race, but you would be marginalized because of your living conditions, for instance. So when an individual is denied equal access to resources and opportunities like education, employment, and healthcare, they may experience a wide range of negative health outcomes. So firstly, there's limited access to education. This can impact an individual's ability to make informed decisions about their health. They're not educated. They don't know what's happening with their health or their family's health. So education can provide individuals with knowledge and skills that are needed to understand and manage their health, as well as access to resources like healthcare services and health promoting activities. Second, there's inequalities of opportunity in employment. Again, if you're not financially stable, this could impact your ability to access healthcare services and resources for yourself and for your loved ones. So people who have lower income, they may have, obviously, they're living in poverty. There's housing instability, food insecurity, all of which can have negative impacts on your health and well-being. There's inequalities of opportunity in healthcare again. So you have limited access to healthcare services for those who are living in remote areas or underserved areas, may be higher risk of illness and disease and may experience delays in treatment. So we're talking about the UK. We're mostly referring to the UK, but across the globe, if you see, if there's a person who's living in a rural area, there were so many women who've lost their lives in rural areas in less developed countries. Because they live in rural areas, they have lack of transportation, they can't access healthcare services. When the woman is pregnant, she loses a child, she loses her life because she doesn't have access to healthcare. So that is very, we can't now make them all come to the urban area, obviously, because it's not possible sometimes. But at least we can give facilities in the rural areas. That is possible. That is hard, but it is still possible. It is more possible than relocating people to the urban areas, which would increase stress upon the already overstressed healthcare infrastructure across the globe, I would say. Finally, there's social inequalities and marginalization, which would increase stress, anxiety, and social isolation, which would impact an individual's mental health and well-being. So when there's discrimination and marginalization, it would also lead to negative health outcomes. An individual may experience reduced access to resources and opportunities, as well as increased exposure to environmental hazards and toxins. So overall, if you see, inequalities of opportunities can have a significant impact on the health and well-being of an individual. When you address these inequalities, it requires a comprehensive and integrated approach that considers the unique needs and circumstances of all these different social groups we've talked about. When we address these root causes, this is when we promote better health outcomes for all individuals, regardless of their social background and circumstances. These are the references for today. Marmot review, just do read this when you're doing your assignment, because it is a very important report that talks about inequalities. These are some of the other resources that you can access. So that's it from my side for today. Just a minute, I'll just see what I have to teach you tomorrow, and then I will let you go. If there are any questions, I'm happy to take them. Any questions from your side?
No, please.
Okay, so in summary, today what we've talked about, can anyone summarize what we've talked about today? And then I'll give another summary myself.
Okay, so today we spoke about inequalities, the
Yeah.
factors that leads to inequalities,
Mm-hmm.
where we talked about genetics, we talked about social life, we talked about
Yes.
um, sorry, environmental factors.
Yes.
So we came into a compromise that our individual lifestyle can affect it,
Mm-hmm.
our gender can affect it, our age can affect it, and
Yes.
then even in the social communities that we live in can also be a factor of inequality to our health.
Mm-hmm.
And some of our decisions, like being a sex worker, can limit is because
Mm-hmm.
of the stigmatizations.
Mm-hmm.
Your disabilities can also lead to that. And then we came back to talk about the um, social economic factors, where
Yeah.
you do not have a job, enough job, you don't have, if you're not well employed, if you're not financially stable, there are
Mm-hmm.
certain health activities that you can't access, and that will
Yes.
limit you. And then when you are from basically a rural area, you don't have access to certain facilities.
Yes.
And then we came to find out that the factors some can be changeable,
Yeah.
but some cannot be, especially the genetics can be changeable. It is
Mm-hmm.
already there. But
Mm-hmm.
those that are changeable too, even there are others that even changing it is it's a bit difficult. That needs extra
Yeah.
access to it before you can change it. And yeah, basically I think that's what's we learned
Yeah.
today.
Thank you, Matilda. Yeah. That's very comprehensive. Do you want to say something as well?
No, please.
Oh. Oriola, if you want to say something. Okay,
No.
yeah. Yeah. So this is what we've talked about. Thank you, Matilda, again. Your goal basically is to understand what impacts health and well-being. So you may have, for instance, again, as I said, a white race that you would say, yeah, there's inequalities there within them. A white person would have better access to health. But then that white person, if that person is living in a rural area, that then obviously decreases those chances as well. So, because if there's no health, then healthcare, then there's nothing for that person also. If there's no employment for anyone, then there's no employment for that person also. But generally speaking, within better, more developed countries, it's again inequalities that do exist there based on race, based on all these factors that we've talked about, based on disability, based on education, etc. We know, if we know the root causes, this is how we can formulate policies and address them. As I said to you, the study that I was talking to you about, it's so important to understand that it wasn't anything else. It was only culture. So if a woman is not physically active when she's pregnant, it's culture. But can you think of anything else also that could be included in this? Like, why is she not physically active? There was several factors, but these were the most striking ones. Can you think of any other factor also? Why a pregnant woman? I'm just talking about this right now because I can relate to it right now, because I'm just working on that study. Environmental factors. What if there's less access to parks there? What if there's no way of exercising? What if there's not proper infrastructure there? What if, okay, so if this is for some cultures, okay? Then there's certain other cultures where even if there's a woman who's pregnant, she has to do all the household chores. She has to do, that's her physical activity actually. So there's several ways to see things, and there's several ways that things turn out to be. So yeah, if your infrastructure, if you have parks outside, what if you don't have safety there? What if a woman is vulnerable, if she's going out, if she's again a vulnerable person, she shouldn't be, based on her sex, she shouldn't be vulnerable. She should have access to healthcare. She should have access to parks. She should have access to everything that is there for men also. So there's several things that are interconnected. You cannot say that, okay, this is just one thing that is there. It's deep down. If you think of an onion peel, just keep peeling it, and there are several layers that come out of it.
Yeah,
okay, that's it from my side. I shall see you tomorrow. So tomorrow is the last learning objective that we will be covering. And we will be talking some bit more about our inequalities basically and how to address them. And then moving beyond that, so if we have our lecture tomorrow on the 18th, this gives you 2 weeks exactly. So the 25th of August till the 1st of September. So the 1st of September will be your date of submission for actually the 2nd of September. So you have 2 weeks time. So if it's the 18th when I give you the last lecture, so this gives you time for 2 weeks. It's till the 1st of September, you have time for your assignment. So I will be, sorry. So tomorrow I'm discussing your 4th learning objective. So that would be done. And then next weekend on the Saturday, I will be discussing the assignment with you. That will be the 24th of August. The 24th of August, I'll stop recording this session. Yeah. Yeah. No.
The assignment you gave us last week.
Sorry?
Is it the